of Health. Dr. Choucair recently launched, while he was at Chicago, an initiative called Healthy Chicago, which was the city's first comprehensive public health agenda in different Chicago neighborhoods. So I know he is very interested in the work that we're doing here with our own health implementation plan. And his work rolling out the massive U.S. vaccination distribution effort has been impressive and much appreciated. It has saved so many lives. So let's welcome Dr. Choucair to San Antonio. Dr.
Thank you, Mayor. Good morning, everybody, and it's so great to be here. We've come as a country so far when it comes to vaccinations. In the last few months here, we've administered more than 348 million shots. We have more than 70% of adults in this country with at least one shot, more than 165 million people fully vaccinated, and that includes 80% of seniors. So we have a lot to celebrate. At the same time, we still have millions and millions of people in this country who still are unvaccinated. And when you take the number of people who are unvaccinated and you take a variant that's much more contagious than previous variants and the wild type of the virus, you have a recipe for a spike. And that's unfortunately what we're seeing across the country and few parts across the country. We've started to see that in Missouri, then we're starting to see that in Arkansas, Louisiana, we're starting to see Nevada, increases in Georgia, increases in Texas, just like the mayor mentioned. So we still have to continue to double down on our efforts to get as many people vaccinated as possible. And this is the main reason why I'm here in Texas. I was in Louisiana last week. I was in Arkansas the week before to try to figure out the strategies that are working and the strategies that we need to continue to double down on to get more and more people protected. We're seeing a lot of engagement with healthcare systems, and I spent the time yesterday and today talking to hospital leaders, doctors, nurses, doctors' associations to make sure that we are making vaccines available in doctors' offices, making sure that hospitals are making vaccines available in emergency departments at discharge. We know that doctors are the most trusted sources when it comes to COVID-19 vaccine information, and we want to leverage that and make sure that that's happening. The other thing I'd want to point out on is we are at a point in the vaccination effort where it's all about the ground game. It is about going community by community, block by block, census tract by census tract, engaging with people, having conversations with people. And I'm truly so proud of the work that San Antonio has done. I got a chance to witness the work that's happening here. We've partnered with the Metro Health team. We've worked with them and got to see the paletas in the park, the local artists, putting the murals, encouraging vaccinations, the efforts, the faith-based efforts that are happening here that I just also got to learn more about. The home vaccination efforts for the homebound, for folks who are homebound that the fire chief and others have been working on. Those are the types of practices that are best practices that we'd want to continue to see more and more of. At the end of the day, there are a lot of people who still have a lot of questions about the vaccine, and we'd want to make sure that we're giving people facts, we're giving people answers. And I have no doubt when those folks who are still doubtful about the vaccine, when they get the answers, they get the facts, they'll be more inclined to get vaccinated. So we still have a lot of work to do, and just like the mayor mentioned, we know that the vaccines work. They are tremendously effective. They're really, really safe. They're very effective at preventing infection, and they're particularly effective at preventing hospitalizations and deaths. And we'd want to make sure that people are getting this message. And as we are seeing the cases and the numbers of cases go up, the silver lining there is we are seeing an uptick in vaccinations across the country, including here in Texas, and we'd love to see this continue to happen, and that's part of the reason why I'm here, and I got a chance to talk to many of the leaders here in San Antonio this morning. So thank you, Mayor, thank you, Judge, for hosting me, and I look forward to our continuous working together.
Well, thank you for coming to San Antonio, Dr. Choucair, and thank you for the grant that we'll be receiving through our hospital system, $1 million grant. I think that gives them some flexibility to hire about 13 people. that will be working in the surrounding area as well as in Bexar County, doing just what you said, making personal contact, trying to get people to understand why it's so important to get the vaccine. And unvaccinated people are in real danger. I don't know how else we can say that. I have a good friend, healthy guy, big guy, cowboy-type guy, don't need the vaccine. Well, he got the Delta variant, was sick for 2 weeks, in and out of the hospital, lost a lot of weight. I texted him yesterday and said, I'm glad you're starting to feel a little bit better. And he said, I did not understand the threat. He did not understand the threat. He does now, but it took a tremendous traumatic period of time for him to understand that threat. So the unvaccinated that are out there, there's 967 of you in the hospital right now, and those numbers are expected to continue to go up as we see more and more people that are unvaccinated, 88, 90%, that are in the hospital, and many of them going on in ICU and on ventilators. We're combining with the city. We will be starting up in August a comprehensive outreach program in terms of actually advertising. I know that we've put in place an order for 33 billboards, as well as we'll be doing social media. The city has a comprehensive effort that will be starting in August also. So between the two of us, we're going to try to get that message over. It's a very simple message, as you see on the billboard that we're going to use. Get the COVID vaccine. Your life may be in danger. And so we hope that will have some impact as we go along doing that. We're continuing to work on vaccines. I know through our university hospital system, we've got 4 clinics set up that's offering those, opening every day. You can go to any drugstore, grocery stores, all of the various clinics through the part of San Antonio, so it's very, very easy for you to do it. So we encourage you to do it, and I want to thank Dr. Choucair for coming here, for the administration's support and outreach, and not only just verbal support, actually putting bucks out there to help on these outreach programs. So thank you.
Great. And thank you again, everybody, for coming up. We do want to, again, express our appreciation to the White House and Dr. Choucair in particular for being here. They have noted the success, but also the great deal of work that yet remains for us to ensure our community is safe and protected from this virus. So with that, we'll go ahead and take some questions, and we'll also be available for one-on-ones afterwards.
Dr. Choucair, we're seeing a lot of the biggest vaccine hesitancy in states in the South. We're also seeing spikes highest in the South. Since this spike has started, it started here in Texas in early July, are we seeing more people in these states where there was a lot of vaccine hesitancy change their minds? Are more people starting to get vaccinated now that they see the Delta variant spread?
Yeah, thank you for the question. We are seeing increase in number of vaccinations nationwide, actually. I think we're averaging now over 800,000 doses per day. Yesterday, we almost saw 900,000 vaccinations. We are particularly seeing increases in states that have higher rates of infections and spread. You know, we're seeing more than doubling the number of vaccination rates in states like Arkansas and Louisiana. We're starting to see some uptick in Georgia, some uptick in Texas. I think people are realizing that the Delta variant is serious. The pandemic isn't over, and that's the silver lining here. And we'd want to encourage more and more people to get vaccinated. This is our path to get the pandemic behind us.
Mayor, Judge, can you expand a little bit more on how children are being affected, the numbers?
I'm sorry, say
The
it again?
children infected with COVID.
In terms of the COVID numbers or our vaccination rates?
The children's falling ill and going to the hospital.
Well, actually, we don't have, up here, we don't have our hospital folks, but maybe, Eric, if you have any data that you can share latest. on our hospitalization numbers. I do have yesterday's sit rep, and as I explained before, we had 967 folks in the hospital. Of those, 262 were in ICU, 149 were in ventilators. We don't have today's numbers yet, but we'll post those very soon. I can tell you that it is the resounding feeling around the table that we are seeing an acceleration of cases in the hospital. That includes all ages. We have heard, I don't have the numbers in front of me, but the average age of the hospital inpatient is dropping and is now roughly, what is it, Eric, about 50? Yeah. In the previous surges, about 2/3 of our patients were 65 and older. It's absolutely inverted now. So younger people are ending up in the hospital, younger people are getting sicker, younger people are being intubated, and younger people are dying.
Dr. Choucair, how frustrating is it to see that the vaccinations have been politicized? And what can folks do here in the southern states to convince their GOP friends and family to get the vaccine?
Well, let me just start by saying is we know that people have still questions about the vaccines, and a lot of people have those questions, and those are legitimate questions. Were the vaccines developed too fast? Are they safe to get vaccinated if you're pregnant? You know, all those questions are legitimate, and we'd want to make sure that people are getting the opportunity to get those answers. So it's really important for people to talk to their doctors, to have conversations with their doctors. From surveys that we've done and from focus groups that we've participated in, it's very clear that people trust people they know. So having these one-on-one conversations with your friends, with your relatives, with your neighbors, with your faith leader, with your community leader, with your doctor about their experience in getting vaccinated becomes really important. I think at the end of the day, it's just the facts are there, the science is there, the data is there. The facts remains clear that if you're unvaccinated, you continue to be at risk of catching the virus. You continue to be at risk of hospitalizations and death. And if you look at the overwhelming majority of hospitalizations that are COVID-related in this country today, they're amongst those who are unvaccinated. Nearly all deaths that we're seeing that are COVID-related, they're amongst those who are unvaccinated. At this point, pretty much every COVID-19 related deaths is a preventable deaths. So for folks who are still thinking about the vaccine, now is the time. It's not about the politics, it's about the facts, it's about the science, it's about protecting yourself, protecting your family, protecting your community. And also a reminder for folks who've gotten their one dose of the Pfizer and Moderna vaccine and they were putting off getting their second dose, it's really important that people get that second dose, because we know when it comes to Pfizer and Moderna, it's the 2-dose that gives you the protection that you would need when it comes to the Delta variant.
I wanted to ask about pregnancy and vaccinations. The CDC website doesn't have exact recommendations on whether pregnant women should get vaccinated. You know, that once somebody does become vaccinated with any vaccine, they pass it on to their children, but they don't know the full effects of the COVID-19 vaccine. So what is the stance right now? Should pregnant women be getting vaccinated?
I think the American College of Obstetrics and Gynecology put out a patient advisory last week that was very clear that they are recommending pregnant women to get vaccinated. The CDC is tracking literally tens of thousands of pregnant women who've gotten vaccinated, and they haven't seen any signal of concern at this point. So the two organizations that represent the docs in this country who take care of pregnant women are very clear that the recommendation is for pregnant women to get vaccinated.
And so you being here in San Antonio, that seems to me that you're going to other cities across the country. What other cities have you been to, and are you seeing the same type of vaccine hesitancy or the same type of maybe vaccine success in trying to get more people? Like, what do you see? Like, what are you feeling nationwide right now?
Yeah, I think there are a couple of things to think about. One, there is no doubt in my mind that there is momentum for people getting vaccinated today, particularly in states that are seeing higher level of spread. There are conversations that are happening day in and day out in this country, particularly in states that have higher disease. and people, I think, are moving towards getting more and more vaccinated. And we'd want to build on this momentum. We'd want to support this work. The second thing to keep in mind is this is truly about the groundwork. This is not easy work, and we have to continue to make the vaccine access as easy and as convenient to people. We have to continue to have one-on-one conversations. We have to continue to encourage our doctors to pick up the phone and talk to their unvaccinated patients. We have to continue to do pop-up clinics and vaccination sites at schools, at community colleges, at universities, at workplaces. All of this is really, really important to get more and more people vaccinated at this point. I mean, the fact remains, if you're unvaccinated, this is a very opportunist virus that's finding those folks who are unvaccinated and is infecting them. And we really have to provide as much protection as we can, and that truly starts with vaccination.
Doctor, there's a shortage of nurses and healthcare workers at the moment. How do you plan to help San Antonio and Texas as a whole with that issue?
Yeah, I did hear about the staffing shortages here in San Antonio today. Yesterday I was in Austin. I heard about that as well. I'm hearing about it from a couple of other states. Our team, we are working on putting together surge response teams to support states when it comes to the challenges that they're dealing with in the surge, and that include things related to testing, therapeutics, staffing as needed, also include things to support from a technical assistance perspective for disease investigation and others. And I know the hospital staffing is a concern that our team is looking at and is working with many states on to try to see how we can support those challenges.
I've heard concerns from viewers that if they do have a bad reaction to the vaccine, they don't have any legal recourse because it's not FDA approved. Is there any option that someone might have to recoup losses, say if they are put off of work or if they do have a bad reaction to the vaccine?
I'm sorry, I didn't hear the question very clearly. Sorry about that.
I've heard some concerns from people that because it's not FDA approved, the vaccine, if they have a bad reaction to it, they don't have any legal recourse. Is that true? Is there any legal recourse that somebody could take?
That would be something the HHS, the Health and Human Services, will follow up on. And we know that the FDA is working as fast as they can. This is a top priority for the FDA to provide the full approval. I heard Dr. Woodcock mentioning that, and we'll have to wait and see. We let the FDA process follow its scientific, rigorous process to get there.
Really quick, I know we've been talking about vaccination, since the beginning of all of this COVID. What are some of the strategies that you guys are going to do now to make people still vaccinated, those who haven't got it vaccinated? I mean, the people that already got vaccinated were the ones that really wanted the vaccine. So what are some of the strategies that you guys are going to now do to make people get vaccinated? I mean, we've been talking about it for months.
Yeah, so several things. You heard the judge mention a coordinated outreach campaign that both the city and the county will be doing. That's one step. We're also working with our mental health department and others, community organizations, even churches and faith-based groups, to make sure that we have pop-up clinics where people are. We really want to hear from folks if there are pockets of the city, the community that have not been vaccinated. We want to get to those members, and we'll set up a clinic for a day or two to reach those people. We also have our MassVac site, as I mentioned. It's open again at the Alamo Dome 4 to 8 p.m. Wednesday through Friday, so they can go there. And Dr. Choucair and the hospital and health leaders talked today about making sure that there are doses available in every single doctor clinic or pharmacy in town. Wherever you can go to get medical assistance, we want to make sure there's a vaccine waiting for you. The most important thing, though, is to deal with the misinformation. I mean, the suggestion that somehow this vaccine didn't go through rigorous testing. The FDA testing regimen is the most rigorous in the world. We're in the middle of a global pandemic. Of course it's going to be emergency use authorized. It is emergency use authorized. So this is a safe, effective, free vaccine for folks. And what we desperately need, because it is your peer group, it's your family member or friend, that can change your behavior. If someone's hesitant in your family or in your friendship circle that hasn't gotten the vaccine for one reason or another, talk to that person. You might be the difference between their life and their death.
This is for the mayor and for Judge Wolf. We've been publicly vaccinating people here in San Antonio since January. How tired are you guys of telling people to get vaccinated?
How tired we are. We're just getting started. If you think we're done, think twice. We're going to talk to everybody until they do the right thing and get vaccinated, because it's not just about their health. It's really not about you. It's about the people around you. It's about those 12-year-olds, those 5-year-olds, those kids that are going to go back to pre-K. We need to make sure that the people around them care enough about the others in this community to get vaccinated. And at the end of the day, it's going to save you money to get vaccinated, because you won't end up in the hospital. And let me remind folks, if you end up in the hospital on an inpatient stay, it's going to take you years to pay off that bill. You can avoid it with a shot in the arm. The other part is, again, we all care about the children in this community, so just go get vaccinated. I'm not done. Are you, Judge?
We're just getting started, and I think the program that we'll be coming out with in August is going to add a lot more push to it than, say, just the two of us. And I know many other organizations are out there. But it's so easy to get the vaccine. It's free. I think in our hospital system, University Hospital, something like 25 or 30 clinics around the city. Now, not every one of them will be giving the vaccine there, because you have to keep the Pfizer under freezer. But if you'll go to one of those numerous clinics, they'll lead you to our Robert B. Greene campus right downtown. They'll lead you to our medical center pavilion, to our southeast clinic, to a southwest clinic, into the diabetes center on the west side. So we're spread out all over. Then you add those like Medcare and WellMed and the other Central Med. I think you're going to Central Med in an hour. Dr. Ernesto Gomez has numerous clinics all over the city. And all you need to do is go to one of them, and they'll lead you to where you can get the vaccine. So it's so easy to get. And so everybody's doing their best to try to get people to go to these clinics. Now the idea is to try to outreach more. But no, we have to keep the message up, and we've got to convince people that are not vaccinated they should get it. If they don't get it, they're in serious, dangerous situation.
Judge, I wanted to ask more about this August program you're talking about. Correct me if I'm wrong, I think I heard you say a little while ago that the city and counties will be getting $1 million for 13 positions. Is that the same program you're talking about? And what exactly are these 13 people going to do?
That is a grant that comes through the federal government. It's going to University Hospital, the hospital I was just talking about, the Bexar County Hospital. And they're going to be working with Bexar County, Atascosa County, Guadalupe County, and Wilson counties that are just around us. And it's going to provide more of a direct outreach to people. They'll be hiring some people to go out and actually knock on doors or whatever they got to do to get to people to encourage them to get vaccinated. So I'm not sure when it'll start, but the grant's been approved, and that's similar to what Dr. Choucair was saying we should be doing.
Question? When we get one more, and then we can go to one-on-ones. Anybody up here is available?
I just wanted to ask, now that I think Bexar County has about 12 school districts in the county, all districts have
16,
different...
I think.
Oh, 16, okay. So all different districts have different policies. What kind of concerns are you hearing from constituents about sending their kids back to school, especially the younger aged ones, and teachers also?
They would be what you expect, that with school districts unable, by virtue of the governor's order, which, again, we've described in many ways, starting with callous and heartless, that they have no control whether or not the people in their school setting are going to have face masks on. And we know that with the Delta variant surging, whether you're vaccinated or not, it is advised by the CDC strongly to be wearing a mask. So we have been working with the superintendents, all of them. with our Bexar County Public Health Authority. We have issued the advisory. They should be going to school in masks. And so we're going to continue to spread that message because, again, it is an extreme concern for all of us.
It's very frustrating. I believe all these districts would be doing the right thing in mandating masks if it wasn't for the governor's order that prohibited them from doing that. Dr. Wu's put out a directive, not a directive, but a recommendation, I guess I should say, to all the schools to actually do that, to wear the mask. If you're a parent and you're sending your child to school, I would strongly suggest you send them with a mask. I believe Dr. Wu said some classes will be starting in the next week or so. So that's a potential danger we're going to be facing right in the middle of the spread of the Delta. And then we're also going to be facing a similar situation when the universities come back in and you have a lot of young people whose vaccination rate's not too good. And they will be hanging around with each other and possibly spreading it. So there's some danger lying ahead, and all we can say at this point is that we hope the school districts do everything they can to encourage people to act in the proper way and to save our children.
All right, why don't we go to one-on-ones? Thank you very much, y'all, for being here. Dr. Choucair, thank you very much.
Thank you. Yeah. Say hello to Ernesto Gomez. He'll be there today. I was with
right in the middle of Tom's speaking. Everybody's going to be like, bye, Tom. Gotta grab my burger now.
FAA. The title is, quote, "Parents are just stuck." Oh, they had that article yesterday. Yeah, with no virtual learning options, some North Texas families are trying to